Hello, and welcome to this second module. This is part 2 of a 2-part module brought to you by the Center for Advanced Studies in Child Welfare. This module is supporting addiction recovery during COVID-19, what child welfare workers need to know. This is part 2. If you'd like, feel free to watch part 1 and then join us here. Or if you wish to, you can go ahead and start with us here. My name is Amy Krentzman. I'm an Associate Professor of Social Work at the University of Minnesota School of Social Work. I study addiction recovery. That's me on the left-hand side of our alumni news magazine. So I study spirituality, gratitude, forgiveness, 12-step programs, sober living houses, the experience of getting sober in rural communities, anything related to supporting addiction recovery. I teach the addiction course, and I also do some child welfare modules, this one and ones I've done in previous years. Again, I just want to thank you for all the hard work you do. I appreciate so much how hard your job is, but how essentially important it is. Thank you for all that you do all the time, anyway, and during COVID, and I know even after COVID. In our first module, we covered a wide range of introductory topics related to addiction support services during COVID-19, an introduction to virtual meetings, and an introduction to the research on AA. In this module, we're going to go a little bit deeper. How does AA work? What's this thing about abstinence-specific social support and why it's important? Additional resources related to 12-step programs, non-12-step programs, people who have a family member they're worried about, that are virtually available, resources for them, conferences, the role of service, recovery community organizations, telephone support, and accessing addiction treatment now, and some overall recommendations for you. So what we're going to talk about next is the research on not whether AA works, but how does it work. And that's what we mean by a mechanism. So a mechanism is let's say AA works. It helps people stay abstinent from drugs and alcohol. But how? What's the thing that happens in AA that causes the abstinence? That's what they mean by a mechanism. And first, I just want to say that the direct effect of AA on drinking is very strong, both in my own research and any other research I've ever reviewed, no matter how you measure AA, no matter how you measure drinking. And no matter how long the time lapse is between AA and drinking, what we always find is it has a very strong, significant effect. In a study I did, if someone declared they were an AA member, then they were 4 times more likely to have 1 year of continuous sobriety a year later than someone who did not say that they were an AA member. And this you find all over the research literature. But there's also this idea of a mechanism, and the mechanism answers the question how. So the person goes to AA, then what happens? What happens in AA? What is it about AA that then leads to them having success stopping drinking? So the research has covered several different mechanisms of AA. The first one is common processes. Common processes are things that exist in any good substance use treatment modality. If you go to your local substance abuse treatment facility, they're going to offer therapy, and that therapy is going to have components, and some of those components are present in AA in detail. Common processes in AA are what they call abstinence self-efficacy. So this is when the person's confidence in handling risky situations increases. So in other words, the person's at a social gathering and they become more confident that they won't drink, or the person's feeling upset, they become more confident they won't drink. Another thing that happens in AA and in the treatment you would get in a clinic is you get an increase in your coping skills, and that's like your ability to have better skills at handling problematic situations like negative mood or a threat in the environment. Motivation for and commitment to abstinence is something that AA delivers and regular treatment delivers. And what they call adaptive social network changes. So this is when the person's social network becomes more supportive of recovery and less supportive of drinking. And that's something that AA can give them. And also if they go to the local addiction treatment center, they'll get that as well. Now, in addition to these common processes, AA has been found to work by way of specific AA-related processes that you would not find in your local treatment center. And these processes are things like working the 12 steps, the 12 suggested steps for recovery, meeting attendance, reading AA literature, and having a sponsor. And different studies have found that these things have been effective in helping people with abstinence. Another set of studies has looked at the spiritual aspects of AA and whether they lead to reductions in drinking. And in research I've done, what I found is that AA leads people to do more prayer and meditation, and more prayer and meditation leads to reductions in drinking. So that was a significant finding for the effect of spirituality as a mediator, as long as the spirituality component involved prayer and meditation. Finally, and most importantly, to the point I want to make in these two modules, is the role of social processes in AA. So a person goes to AA and a very important social dynamic kicks in, and that social dynamic leads to abstinence and the maintenance of abstinence. And it's this social dynamic that makes it imperative for us to help our clients get to these virtual online meetings now during COVID, because these social processes, more than anything else, are going to help them stay sober, get and stay sober. Let's talk more about what we mean by these. So these social processes have to do with enlarging the person's social network and enhancing their network support. But more specifically, it enhances their social network support for abstinence. So it's a specific kind of social support. What it will do is it will increase the person's, it will, decrease or reduce the person's pro-drinking influences on their life, and it'll increase the number of AA-related role models and AA-specific network support, and this all-important role of abstinence-specific social support. That is, friends, people in their social network, and that includes people they only know online, people who are pulling for them to stay sober. And this social support is essential. Overall, you might be interested to find that researchers have said that AA works in part because it's free, it's long-term, it's widespread. Nearly every community has an AA meeting across the country and even around the world. This concept of self-dosing, by using the word self-dosing, researchers are using a medical term. They're using sort of like the medical terminology. When someone needs a meeting, they get themselves a meeting. If they need 3 meetings this week, they go to 3. If they need 5, they go to 5. If they need 1, they go to 1. As much as they need, they can access. They can moderate the amount of meetings they go to, is what that means. And AA exposes individuals to recovery-related benefits. These common therapeutic benefits we talked about, the AA-specific benefits, the social benefits, and the spiritual benefits. So it gives them all of the things we've just been talking about. And here's just a visual depiction of all 4 of the mechanisms active in AA. I just want to say something interesting to me that I find fascinating about social processes and abstinence from alcohol problems. So back in 2015, I read this article in the New Yorker, Experiments in Sobriety, and I want to tell you a little bit about this because it speaks very strongly to what happens when people get abstinence-specific social support. In this particular story, it talked about a young man in Australia who was working for an advertising agency, and by his own admission, he was a very, very heavy drinker. And the advertising agency got an assignment to do a drinking awareness campaign, and they assigned it to their heaviest drinker on the staff, this young man. So he went home and he thought about it, and he thought, if I'm going to design an advertising campaign that says, watch out for your drinking, he said to himself, I've really got to myself walk the walk. I've got to myself stop drinking for a period of time to even wrap my head around this advertising campaign that I'm being asked to write. So what he did, he went online and he started blogging about it. He decided to quit drinking for 1 year with every intention of returning to drinking again, and in fact he did return to drinking. He went online and he said to his friends, "Would anyone else like to join me on this 1 year of abstinence?" What he was doing really is he was reaching out to his friends for abstinence-specific social support, for a buddy who would also stop drinking with him for a year and join him on that journey. He got no takers. So he said, all right, how about 6 months? Who would be willing to stop drinking with me for 6 months? And his friends, crickets, no one was interested. But then he said, how about 3 months? Who among you would like to join me in stopping drinking for 3 months? And a bunch of his friends stepped up and said they wanted to do it. So by way of this blog, which was a virtual form of social support, these friends started to support each other in their aim of staying sober for 3 months, and it worked. And I tell you this story to emphasize this to me it's incredibly fascinating, that people who decide to stop drinking together, each person deciding they're going to stop, and they're going to stop as a group, and they're going to support each other, this actually helps that whole group stay abstinent. Even if they fully intend to return to drinking again, as they did in this example, Experiments in Sobriety. Now, before there was Alcoholics Anonymous, you might be interested to know, there were many other, throughout human history, there were many other groups of people who convened together and decided as a group, let's each of us stop drinking. And they successfully helped each other to stay abstinent. And those different groups are described in this wonderful book called Slaying the Dragon, The History of Addiction Treatment and Recovery in America. But the reason they say that Alcoholics Anonymous has lasted so long is that it has some built-in principles that keep it from going out of style or becoming embroiled in public controversies, so it stays healthy as an organization. Therefore, it's been more long-lasting than any of the previous groups. Let's go on. So there's additional online 12-step resources. Let's go through these quickly. There's a link, XA Speakers, that's previously recorded, recovery talks. And then every other 12-step program modeled on Alcoholics Anonymous has online meetings now that I looked at. Gamblers Anonymous, Overeaters Anonymous, Sex and Love Addicts Anonymous, Codependents Anonymous, Adult Children of Alcoholics Anonymous, and Marijuana Addicts Anonymous, which I've since added to the website. And then there's an important website you should know about called In the Rooms, which connects people with 12-step programs that are virtual. Now, as I said, I've been talking a lot about 12-step programs throughout these modules, and I want to let you know I'm fully aware that not everyone loves 12-step programs. 60% of treatment providers use a 12-step model. So many who have attended treatment report that they've been to a meeting already, and yet still very few stick. So most people who've been through treatment fail to go to at least one meeting a week in the year following treatment. So people are being exposed, but they're not sticking. Now, research has shown that one big reason that people don't like 12-step is because of its spiritual aspects. So let me be clear about this. AA is not a religion, but it has a spiritual component. It recommends prayer and meditation, and it's theistic. It names God and a higher power. However, AA says that all of its suggestions are merely suggestions and they are not requirements. However, even still, some people just cannot stomach the spiritual component. So there's a very important role for 12-step alternatives. These would be mutual aid groups that leverage this abstinence-specific social support I was just talking about. Groups of people who all want to stop, and they can support each other in successfully stopping. But they're secular, so there's no theism, no mention of a higher power, there's no prayer at all. And these groups are flourishing. Let me introduce you to these groups, and again, this is a screenshot from our website, how to find other addiction support groups that meet remotely if you'd like an alternative to 12-step groups. And these groups are Smart Recovery, Women for Sobriety, Life Ring, The Minnesota Recovery Connection offers all recovery meetings, so no matter by what venue you are recovering, you can go to that meeting. Recovery Dharma is a Buddhist group, and I want to introduce you to AA Agnostica. AA Agnostica is a website of resources for people in AA who don't like the God part, and it's readings, books, meetings. So these are actual AA meetings that don't use the God part at all. And there's no mention of, there's no praying in these meetings, everyone there gathered. They want to stop drinking, but they don't want the God part. They don't want the spirituality part. But there's plenty of these meetings, and these meetings are virtual. So there has been research on these alternatives to 12-step groups, specifically research on Women for Sobriety, Life Ring, and Smart Recovery. And what they found is that members of these alternative groups are less religious, so that's no surprise. They had more education and greater incomes, and they went to fewer in-person meetings than 12-step members. Members of alternative groups rated their groups higher on satisfaction and cohesion than 12-step members did. Women for Sobriety and Life Ring members were older, more likely to be married, and their addiction and mental health problems were less severe than that of 12-step members. Now, the important question is, do these groups work as well as AA? First of all, the research has shown they work just as well as one another. Women for Sobriety, Life Ring, and Smart Recovery work equally well to one another. But when they compared these groups to AA, they found out that AA slightly overperformed on drinking outcomes compared to these groups, but let me explain why. And this slide shows why. So first, let's go to these categories on the lower axis. Most people, and here's the key, so that the black bars are 12-step members, darkest gray is Women for Sobriety, next shade of gray is the Life Ring people, and the palest gray are the Smart Recovery groups. And I just want to point out, these are different goals related to drinking. In the far left goal, it's people who say they want to quit using alcohol forever, they want to be abstinent and never use alcohol again for the rest of their lives. I want to point out that is the most popular option for all the groups. But there were people who endorsed these other drinking goals. One is, I want to be abstinent forever, but I realize I might slip. Another is, I want to be abstinent forever, the other one is, I want to be abstinent for now, but later I want to drink. And this one is, I don't want to be abstinent at all. I want to reduce my drinking. Now, when you look in this first option, you see the 12-step groups have a higher proportion of their people saying, I want to quit drinking for once and for all, be totally abstinent, and never use alcohol again for the rest of my life. And that drinking goal is the advantage that made 12-step groups outperform the other groups. If the researchers statistically adjusted for that drinking goal component, then all of the groups, AA and all the other alternative groups, performed equally well. And this next slide just simply talks about that finding that I just described. On our website, we have resources for those who are worried about another person's drinking, such as Al-Anon, and they are having virtual meetings. And in fact, there has been research on Al-Anon. Al-Anon newcomers who were still attending Al-Anon 6 months later reported a host of different improvements. First of all, they felt Al-Anon improved their ability to handle problems caused by the drinker. They felt Al-Anon increased their well-being and functioning, and they felt their relationship with the drinker improved. And when they did a second study that looked again at the mechanisms, okay, Al-Anon helps deliver these benefits, but how? And the how all had to do with social processes of Al-Anon. People who said they felt a sense of belonging to the group. People who said the group helped them work toward their important goals. People who said they met members who were role models. And people who shared activities with Al-Anon members outside of meetings. So again, that all-important social component, even for the families of people with addiction, that delivered these benefits of Al-Anon. Here was one of the most exciting findings I found in my research developing the website, and that is the finding that 12-step conferences, which you might be aware tend to go on at the local, regional, state, national, and international level. These face-to-face conferences have been, by and large, canceled. Go for State, which happens over Memorial Day in the Twin Cities, has been canceled. The AA International Convention, which happens only once every 5 years, scheduled for this summer in Detroit, has been canceled. But these groups, these meetings, are now happening online. And I have a link in our website to this incredible array of online conferences that are going on online. And the other exciting thing I only discovered recently is that many of these conferences have been recorded, and you could listen to the recordings at your convenience. And our website links to those recordings. Let's look at just a sample of a few of these. This is one that happened recently, Gold Coast Rally. And by the way, the website link is kept up to date. So these flyers I'm showing you are old. They're things that already happened, but the website keeps everything up to date with only, it takes down the old stuff and it puts up the new stuff. So let's look at this. Gold Coast Rally 2020 into action. They list the time, but there's an asterisk. The asterisk tells you that all times are Brisbane in Australia. So we've got to do some math and convert the time difference, and then we can listen in on a Saturday to all these speakers speaking on the steps, and then on Sunday, all of these speakers speaking on these various topics. And again, many of these have been recorded, and people can listen to them anytime they want. Here's something fun. This came up and happened last weekend. It was an AA stand-up comedy night. It started off with a speaker, and then it went to AA stand-up comedy. And this was recorded, and it's a little tricky. Sometimes it won't say, it'll say what time, 8 p.m., but it won't say where. But when you notice that all the speakers are in California, you can guess that it's Pacific time. So sometimes you have to kind of use some sleuth skills to find out what's the time change calculation so your client can participate. Also in that link is a flyer like this, Tokyo Young People's Group. This is just simply a meeting, advertisement for a meeting, taking place, again, it's this location agnostic idea, taking place in Japan, but it's English speaking, and your client might want to take advantage of this to try something new. I want next to talk about the importance of service in recovery from addiction. And in our website, there is a link to volunteering to be of service to some of these virtual meetings. The importance of service is that it amplifies the role of helping to support addiction recovery. So as we said before, service implies a deeper involvement in AA versus just AA attendance, which is associated with better rates of abstinence. The first paper on this, I'm proud to say, was in a social work journal in 1965. It was a paper called The Helper Therapy Principle. And this paper showed that when a person is being helpful, they experience a therapeutic benefit. Some of the interesting psychological components to this benefit is what they call the saying is believing effect. And this is when the person being helpful to someone else is talking to that person, but the person they're convincing more than anything is themselves. There's also a psychological principle called the self-affirmation theory. And this is that when people are reminded of positive aspects of themselves, they view negative events as less stressful and threatening. And when people help other people, they are reminded of positive aspects of themselves. Here are the words of one of my research participants. When she did a helping exercise, she said, it makes me realize I really do care about people. I'm not selfish. I do care about others. It made her feel good about herself. There's research on helping, and this research has found, for example, that in a sample of individuals with alcohol use disorders, those who were helping others were significantly less likely to relapse during the year following treatment. And helping was defined as being a sponsor or having completed Step 12, and Step 12 has to do with helping other alcoholics. I want to emphasize this awesome resource we have in Minnesota, but local communities across the country have this resource. This resource is Recovery Community Organizations. This is a relatively new recovery support service that has come about in the past 15 years. These are organizations in the community. Before COVID, these are places that had offices that were staffed with people. And what they would do, a primary thing that they would do, is they would train people in recovery to be professional recovery coaches. So these people abide by a code of ethics and they get some training. And they're trained to help other people in recovery. And these volunteers will do a whole range of things. First of all, they'll answer the phone. And now during COVID, these phone lines are open. And your client can call them up to get resources. Very, very important now in the time of COVID, these recovery community organizations. Also, if your client wants, they can list their name and they'll get a weekly recovery support call from the organization. They have meetings, virtual meetings. It doesn't matter what path to recovery. Recovery community organizations take the philosophy there is no one way toward recovery, and that all paths to recovery are equally valid. Now, here in Minnesota, I was thrilled to find that there are 5 recovery support community organizations all throughout the state, and their telephones are on and they're answering the phone. I did hear that if your client leaves a message, if your client gets the voicemail, they should leave a message and they'll get a call back. Here's a list of resources for your client. If they have a phone but no internet, the first thing they should do is call their recovery community organization and ask them for, can they recommend a telephone online meeting? So those numbers would be very important. Of course, we have some emergency numbers here on our website and some numbers related to resources in the Twin Cities. In terms of treatment, many addiction treatment centers are open during COVID-19. We have links to treatment centers, and a helpful link called the Fast Tracker is one that I really want to highlight. This is one where your client can put in the type of treatment they're looking for, and it'll connect them with treatment centers that have availability. We're coming to the final bit of this second module, and that is my list of recommendations for you. First, I recommend that you encourage remote meetings for all the reasons I'm describing, mostly because it'll connect your client to this all-important abstinence-specific social support. Encourage your client to think of it as an adventure. Shore up their strengths, that it takes courage to give this a try, and generate excitement that they're going to see people in recovery all over the world, and people who are flourishing even in the time of COVID. A great way for you to help sell the idea of an online meeting is for you yourself to try it. I urge you to try it, an open meeting, a virtual open meeting of AA or NA. The meeting lists readily indicate which meetings are open, and that will give you the best tools you need to describe the experience to your clients. Take the time with your clients to explain basic computer skills, how to navigate to a website, how to bookmark a website, how to download an app, and how to get on Zoom. This is time very well spent right now. I feel that these computer skills are life-saving clinical skills right now for your client. Become familiar with our website, share our website with your clients, and take a tour of the website and walk through it with your clients. Use these slides in any way that is useful to you. We're going to provide them to you with a link, and you can open them up and save them and then be able to modify the version that you save. I think you should encourage your clients to make a map like this one of each day of the week and which online meetings look good to them each day. So all they have to do is wake up and say, today is Wednesday. What do I have going for Wednesday in terms of a good-looking online meeting? And each day they would wake up, look at their list, and get oriented to which meeting they're going to go to that day. The usual advice applies to the current times. You might want to tell your client to try at least 6 different online meetings before deciding it's not for them. Tell them to arrive early at the meeting and to stay late, because in the chat, people exchange resources at this time. A huge recommendation I have for you is to learn the MAZE model. MAZE stands for Making AA Easier. It was developed by Leanne Cascudas, and it's a 6-session group procedure where people are slowly socialized into the AA experience. Now, on the left side of the slide, I'm not going to go through this in detail, but on the left side of the slide, it's the original MAZE model where people are introduced to AA, and then there's a series of rotating topics. And after each topic, there's homework for the person to go to an AA meeting, and get a phone number, go to an AA meeting and socialize with others, go to an AA meeting and talk to someone else after the meeting, go to an AA meeting and find a temporary sponsor. What I've done on the right-hand side of the slide is I've rewritten the MAZE model for the current COVID pandemic environment. And this is a way to gradually socialize your client into the current reality of AA and AA alternative meetings. And what I've suggested here are activities week by week your client can do to slowly engage and become involved in online meetings. So have a look at this slide at your convenience. I bet you're going to think of ways to improve on what I did here on the right-hand side. And this is a very powerful tool for your clients. I can't recommend it highly enough. With that, we come to the end of the second module. Here are the references to all of the academic resources I cited in both modules. I want to thank you so much for investing this time, for caring about your clients so much during this time of COVID and the important and devastating disease of addiction is not dormant during this time. If anything, it's been inflamed, and yet you are doing all you can to learn about how to help your clients. I'm really in awe of that. So thank you so much for joining me. All the best to you.